Dr. Karen. I'm so excited to be here for all of you. I'm an integrative skin and aesthetic specialist. I'm an MD. I'm from New York. I'm here working at Isya Aesthetics. I'm the founder in New Delhi. I'm here to answer all of your questions for the ELLE Weekender event. I'm so excited to do this. So let's get down to it. I'm going to go and answer each and every question that you guys send in, and I'm going to answer it well. So I hope that you take this info home with you and really get to use it in an educated and intelligent way. So shall I get started? I think I will. I'm going to go through the questions right now. So I got a bunch of them. So I got one question as in, what's my personal AM and PM routine? And I think that's a very good question because everyone has their own routine, and actually I believe that everyone's skincare should be very intuitive, which means that based on your skin type, based on your lifestyle, based on what concerns you face is how we end up choosing a good skincare routine. Like, for example, some people are very oily in the morning and some people are very dry at night, or vice versa. Some people in the afternoon just feel so sweaty and greasy in the monsoons, but in the winter they feel very parched. So each season should actually have its own routine, and each time period in life can have its own routine. When I'm extra stressed, I'm way more oily. When I'm less stressed, I'm more dry. So, you know, you'll have to, it's a lot about understanding yourself. So my personal routine is I tend to be dry in the mornings and more oily at night. I also like to have a good anti-aging routine. I like to be nice and hydrated, and I like to glow. So I have a gentle cleanser in the morning. Right now, I keep changing, to be honest, because I get so many different products and I like to try it in order to give a good detailed response to my patients when they ask me what they should use. So right now, as of like this week, I'm using Atoderm Gel Moussant by Bioderma, which is a nice face wash that is foaming but great for dry skin. Sometimes I use a gentle milk cleanser. Sometimes I use an oil cleanser. It just depends on my mood. Once in a while I use a scrub, but that's what I'm using right now. Then I also use a vitamin C product, so like a 30% vitamin C. Right now I think I'm using Trivita C30. Sometimes I use ELLE's vitamin C. Sometimes I use Novaji's vitamin C. It just depends on what my mood is and how strong I want to go. Since it's really summer and hot outside, I'm using a stronger vitamin C. In the winter, sometimes I use a lighter one, but if it's very polluted, I go up on the percentage of vitamin C. Then I'm using ELLE Hydrocool Serum, which is a hyaluronic acid serum, but there's so many hyaluronic acid serums. Don't take these brands as like endorsements per se. It's really just what I'm currently using and what's working for me. But a good, decent hyaluronic acid serum is great because the more hydrated your skin is, the healthier it is. Then I use a moisturizer. I'm using SVR Secavit, but sometimes I use Bioderma, sometimes I use Cetaphil. I mean, I mix it up. And then a great sunblock. I'm sunblock crazy. So like 2 goops, or like 2 finger lengths or 3 finger lengths every 4 hours. And actually I credit that with having decent skin now because I started that when I was very young. So I feel like I avoided a lot of the trauma that could have happened. Then at night, I'm actually using a topical retinoid, which will help, which is anti-aging, but also helps me a little bit with my tiny scars, and also just prevents acne. And in this summer and in this heat with the masks, it's great for me because it's like an all-in-one. And then I use an anti-aging moisturizer. You know, right? There's so many different options out there. Right now I'm using ELLE's moisturizing complex because it's light and good for the summer. But sometimes I use Filarina because it's so deep and hydrating as well with the hyaluronic acid one. But there's, again, so many options. Like I said, don't take these as brand endorsements per se, but just consider this is what I'm currently using. All right, next question. How often should one exfoliate? That's a great question. So how do you decide how often you should exfoliate? If you're oilier, if you have more blackheads, your skin isn't sensitive, by all means exfoliate twice a week, even 3 times a week, no problem. Your thicker skin as well. So thick skin, oily skin, skin prone towards blackheads, and not sensitive skin. Now, the moment any of those parameters are gone, so say your skin is really thin, say you're super sensitive, say you tend to be more oily, so cut that exfoliation down to once a week. And if you're really sensitive or have traumatized skin or have rosacea, you can really exfoliate even less than that. So really go with your skin. If your skin is feeling sensitive, don't exfoliate. Your skin then needs that extra barrier on top. It needs those skin layers on top to help protect it from the elements if you're really, really sensitive. So don't take that. Don't think that if I exfoliate, all of my problems will go away. In fact, very often it can get worse. So exfoliation is not the cure to all problems. So we want to be very, very careful. All right. Another great question is it fine to use retinol during pregnancy? So technically, no. Although they haven't shown necessarily that retinol is absorbed during pregnancy, but because we know oral retinoids like isotretinoin has pregnancy complications, we anyway as doctors don't want to take the risk. And for what, right? It's just a certain time period. Once your pregnancy is over, we can deal with all the consequences that are on your skin. So no, we don't recommend retinols during pregnancy. Okay, another great question. Is face rolling really beneficial? Facial rolling. So I personally am not a fan of the jade rollers too much. I think that, or the other rollers or the vibrating rollers, etc. I think that they're not required. Are they good benefits as add-ons? Sure. Everything can give like a 1%, 2%, 3% benefit, no harm, no foul. But sometimes people are using the rollers and giving themselves very, very sensitive skin. They're taking these strong actives like retinols or alpha hydroxy acids or things with really, really low pHs, and they're using the roller on top. And what that's doing is that's making that product go deeper into the skin. When we formulate products, we don't necessarily formulate them to go into the deeper layers. We formulate them because we know this much if we apply, this percentage we apply, this pH we do, it is safe because only X percentage can be absorbed and the skin will automatically balance the pH. Now, the moment you roll on top of that, you try and penetrate that deeper, you've basically thrown that whole formula out of whack. Okay, and that's really an issue because you don't necessarily want a strong percentage of retinol penetrating really, really deep in your skin right off the bat. You can definitely give yourself irritation. You can give yourself rosacea. The incidence of rosacea has gone up tremendously, and I think it's a lot in association with too many home things, home scrubs, home rolling. It's a lot more complex than that, is what I want to say. I don't think, while it sounds all fun and it sounds really exciting, and I know it's really beautiful to look at and like, yeah, I can make my skin great, but there's actually a lot of complexity to what your skin does, and your skin is designed to be a barrier. It's actually not designed to be perfect looking. It's designed to be a barrier against the elements and to express what's happening inside the body. So when you start making the skin only about looking nice, very often that's when things start to go into a tizzy. So face rolling, if your skin is thick, you're not using super strong retinols, AHAs, BHAs, or irritating ingredients. You're not using ingredients with certain preservatives, certain emulsifiers, certain colors, or fragrances. Then, okay, no problem. You can do it maybe once a week, but don't go overboard. I've seen some really bad complications that can take months to get rid of. Let's see, next question. All right. Okay, my old stretch marks are suddenly very itchy. What can I do? So that's a really interesting question. What are stretch marks? Let's start from the basics, okay? Stretch marks are essentially as your skin, say you're getting fatter, like you get pregnant, you know, maybe the word isn't fatter, but larger. Say you're getting larger, you're pregnant, your tummy's coming out, skin is stretching, or say you're gaining weight, or say you're losing weight, or say you're getting taller, right? A lot of teenagers, like teenage boys, they get taller and they develop stretch marks. So anywhere the skin is stretching, if the skin doesn't have enough elasticity in it, so like a rubber band, right? Your skin will stretch and come back, stretch and come back. If it doesn't have enough stretch, then it breaks. So in the middle layer, when the skin breaks, that's where it forms those tiger stripes. That's the lack of elasticity. Now, when that process is actively happening, that active stretch, sometimes the stretch marks can feel itchy. So if you're actively, maybe the stretch marks are getting worse, maybe they're actively trying to heal them in your body, whatever it is, that's when sometimes the stretch marks can get itchy. Another time the stretch marks can get itchy is if you're applying something and that's making it dry or irritated, or you're trying to get rid of them on your own again, or you're doing procedures on them, and the healing process sometimes can make them a little bit itchy. Or if you're pregnant, sometimes certain stretch marks can have itch in them because it's a specific pregnancy-related skin disorder, which is separate. So if you're feeling like your stretch marks are getting itchy, it's definitely something to look at, especially if you're pregnant, and see and make sure that it's not a specific disease or disorder that needs to be treated. But if it's just some mild itching, then you can just watch it and wait and avoid anything but good moisturization and elasticity creams. And if that doesn't work, then see a doc, because that's what we're here for. All right, next question. Skincare tips for PCOD patients. Wow, you guys really sent in a lot of questions and really good ones. I'm really happy. Okay, so skincare tips for PCOD patients. Now, PCOD patients, so there are different types of PCOD, okay? I tend to classify them by the blood tests and the symptoms. So the ones who have more elevated androgens or male hormones, you know, that's one type. The ones who are elevated in their sugars, more insulin resistance, that's one type. The ones who get it after they come off the pill, you know, a lot of people when they go on oral contraceptives or hormonal medicines, they essentially can actually have that hormone imbalance develop when you come off. So that's post-pill type. And then there's stress-induced PCOS as well, which will often show up with lots of cortisol. And also, again, those male hormones are really elevated. These are like my 4 types of PCOS. So everyone sort of presents a bit differently. If you're high on the male hormones, you're way oilier, your scalp is oilier. Very often, you can feel like you have hair thinning, but then your hair is growing more on your face and your body, you get more acne. So skincare is really a lot around preventing acne, treating acne, reducing some of that oil, and a lot about diet, which I'll get into after that. If you're more insulin resistant, again, we're a lot more into antioxidants and collagen boosting, because the more sugar is circulating in your blood, the more collagen degradation is happening and the more skin trauma is happening. So then we look at a lot more skincare, a lot of sunblock as well, because we want to prevent that. Again, dietary interventions. So what dietary, and sunblock, guys, sunblock, I mean, if you're already, your body has some dysregulation, then we want to reduce all of the other extrinsic stressors on the skin, and the sun is a big one, as is pollution. So what diet recommendations do I have? Oh, I have so many. So with PCOS, I always tell patients, you know, you're easily triggered. It's like your body is way more sensitive. It's not as, the word is not resilient. It's not as stoic as a non-PCOS patient. So say you have a little extra stress, say you ate way too much sugar, say you didn't sleep well, you know, you are going to be more likely to get that zit than the average person. So that's something that you should just understand. Your body is just way more sensitive. Now, what do we do? How do we manage that? So one is we put you on, like I said, preventative things, lots of good sunblock, vitamin C's, or other antioxidants if you're sensitive to vitamin C, topical retinoids if you have a tendency towards acne, laser hair removal if your hair is a problem on the face, stuff for the scalp if your hair is thinning. So all of this, we really put you on a preventative regime. We watch you for when you get triggered, and we treat right away because we don't want it to get bad. And we don't want those marks and scars to happen. And we also do a lot on your diet. Now, diet is so key in PCOS because your body is such an interesting fine-tuned machine. We do a lot of reducing the sugar in your diet, which is obvious, okay? So we want to cut out the sugar, we want to cut out the processed foods, those desserts, those like jalebis, okay? We don't want to be a jalebi baby. Although I love that song, but we don't want to be a jalebi baby. These are all the things that are going to worsen the situation. The more sugar circulating, the more the hormones go into disarray. The other thing that we talk a lot about is, like, when we talk about sugar, we also mean high glycemic foods. So those are foods that raise your blood sugar really high, really fast. So they spike your blood sugar and they spike your insulin super fast. We don't like those. So things like white potatoes, white rice, although white rice is not that bad. Maida is a biggie. Anything with maida in is a problem. A lot of refined wheat is really just, you know, almost maida. And most wheat now that's processed and milled and tends to be pretty high glycemic. So we avoid things like that, bread, right? Rotis, naans, although they're so young, but not. So these are all the things that we avoid. So that's in the sugar range. Now, the other thing that I also believe is that we should cut out things like dairy. Right? Now, dairy, which has been shown, dairy has been a big proven factor to increase acne and to worsen PCOS. So dairy is something that we say no, no, no. And that's basically milk and cheese, not yogurt. Yogurt is well fermented, so yogurt is not as big of a stressor for us, but milk and cheese, that yummy paneer, all of that stuff needs to cut out. You can have a little bit every week, but not too much. So these are the biggies: high glycemic foods and sugar. Sorry, high glycemic foods and dairy. And remember, the more processed your food, the further away it is from nature, the worse it is for your body. So you just keep it clean. Also, drinking lots of water. That's really key. Water is very important for us. And water doesn't just mean water. Water also means things like coconut water. It can mean fresh juices, although not the canned ones, the ones you make at home. It can be lots of fresh fruit. Fresh fruit is anyway better than fresh juice because you have fiber in it, lots of vegetables. Nimbu pani, all of that is good electrolytes and good hydration. So remember that. So those are my tips for PCOS. Okay, so many more questions. Let's do this. How to cure pimples and oil on my face? No, that's a good one. Now, all pimples are not alike and all oil is not alike. Typically, there's so many different causes of pimples. Is it the products you're using? Is it how you're treating your skin? Some people wash their face 10 times a day, and actually your skin will create way more oil than it otherwise would have. That's a problem. So sometimes it's the masks. They use the same mask for the next like 7 days and like, why am I getting pimples? Obviously, there's tons of sweat, bacteria, everything accumulated on that mask, and that will cause some zits. So those are other causes. Sometimes our phone on our face. That's big causes also. Other things. Now, the other things are the internal causes. So hormonal disruption, stress, right? Sleeping badly, really stressed about that exam, really stressed about life. You know, a lot of acne happened after this last wave of Corona. Very stressful. Hormone changes, PCOS, as we said, hyperandrogenism, the other various hormonal causes. Another cause of acne. Third thing, sometimes it's rosacea. It's not acne. Rosacea can show up as pimples. Sometimes it's perioral dermatitis. Sometimes it's dandruff on the face. So all pimples are not alike. The causes are not alike. The treatment is not alike. And there's a lot of balancing of your lifestyle. There's a lot of skincare. There may be oral medications if needed, if it's a severe type. And also hair care is important. A lot of hair products can cause acne. So there's no curing of pimples and acne. There is treating and then preventing and then watching out, because as we get older, even adults get acne now. And we want to see and prevent all of that too. So that's that. Okay, someone asked, next question. I have a mole on my face since childhood. Is getting it removed risk-free? Young lady, nothing in life is risk-free, but it's pretty safe. So you can get a mole removed, you can get it excised or cauterized or lasered. The risk is that you may have a scar, but that's usually rare. And you have to decide, is the scar more upsetting to you than the mole? I personally love moles. I think they're so sweet. I really like them. I try not to remove them unless I have to, or unless I think that you're at risk for an issue or a cancerous lesion. But I think that sometimes the scar is much smaller than the mole. So if you don't like the mole, the risk of the scar or the actual scar that could happen tends to be smaller than that. So that's a call that you can make. The other risks would be infection. Again, very rare as long as it's done properly and you're careful and you use good antiseptic care post-treatment. So that is that. Where I live, there was hard water. Can I use distilled water for face? Yeah, you can use distilled water for face. So it's not necessary that hard water will be bad for your skin, but sometimes it can make it feel drier. And all those minerals, when they layer on the face, it can feel just like it's not clean. So yeah, you can absolutely use distilled water. That's fine. You can use any water you like on the face. Don't worry about that. Okay, why is my nose rough and oily while my face is fine? Okay, that's a great question. So we all have a T-zone, all right? This and this, and even here. We actually have more oil glands in this area than in the rest of our face. So the nose tends to be where a lot of that shows up, right? You can see those little follicles on your nose. So that's probably, you have just excess oil being produced in this area, and that gets obstructed. Like a little scrub once a week just on the nose will help you. If that's not enough, do a nice facial, a hydrofacial or something like that is usually pretty great and effective. So nothing to worry about, very normal. Most of us have it, even I have it. It's okay. I don't really stress about it too much, and you shouldn't either if you can avoid stressing about it. Okay. Next question. Causes and treatments for tiny dark spots or freckles on the nose and cheeks. Oh, I love freckles. Okay, so I also love freckles, but if you want to remove them, I can understand. Freckles, some skin creams can help with like azelaic acid or kojic acid or licorice extract or certain alpha hydroxy acids. Sometimes hydroquinone if done under supervision of a doctor. Lots of great things. Vitamin C, such great ingredients we have. If those don't, and sunblock, because you want to prevent the freckles from happening more. So this is your skin here. Now, if that's not enough, then we do so many options. You can laser them, like we do PicoSure and freckles. They come off in 1 or 2 sessions. Or you can do a photo facial, like we do Photo HD. It helps with glow. It helps with sensitivity. Also helps boost collagen. At the same time, you're improving the freckles and reducing them. So that there's so many options. The third thing is sometimes you can cauterize them, form a little black scab, and they fall off. That's again 1 or 2 sessions. So many options for freckle removal. But remember, freckles come back. So wear lots and lots of sunblock to prevent that, and do a good skincare routine, like an antioxidant skincare routine, which is very, very important. Okay. Next question. My skin, okay, how to deal with acne marks. Acne marks. So acne marks, there are many different types of acne marks, okay? There are dark marks. There are red marks. There are brown. When I say dark, there can be brown or like grayish black. There's red. There are scars, so atrophic, like holes in the face. And those can be different types of holes. They can be box scars, so they have like almost like a square, like a sharp margin, and they go indented. They can be rolling, so they're like a soft low. They can be ice pick. They can be all these types. They can be all different mix of these 3. These are like the big major types of atrophic scars. And then they can also be papular, so little bumps where the scars are. That's another thing that it can be. When you have a little bump, that's a papular scar. The last type of scar is a white mark, which is called PIH, but is post-inflammatory hypopigmentation. So you get a white mark where the pimple is. So there's all different types of marks out there when it comes to pimples, and we want to treat them a little bit differently. If they're red marks, then we use a lot of like the different variations of azelaic acid. That seems to help, or something that helps with the blood vessels, like a bit of hesperidine or vitamin K. If they're brown, that usually means it's more superficial. It's a superficial mark. Then some AHA, some vitamin C, some polyhydroxy acids. Those are great. Darker marks, we look at alpha-arbuteins, we look at hydroquinone even, retinoids. These are all great actives. The other anti-mark actives, also anti-pigmentation actives like kojic, licorice extract. Again, if they're white marks, there's not much we can do except a little bit of aloe vera. And if they're atrophic scars, we can try retinol, you can try silicone gels, you can try hyaluronic acid gels to hydrate it, but really it's treatment. It is treatment like lasers, like ablative lasers, like Pixel Perfect. It's treatment like microneedle RF. It's combinations of those. It's PRP injections. It's filler. It's skin boosters. But they are well treated, so atrophic scars can be well treated. Okay, and if the marks aren't going with the creams, by the way, the dark marks or the red marks, those also can be treated. The red marks with photofacials, the dark marks with PicoSure or a good Q-switch laser like Brilliance or Clearlift. These are all great options. Okay, let's see. What's one product you wish existed for sensitive or all skin types? Ooh, my dream product. I feel like a good balm that doesn't cause pimples. You know, like a great, like in America, I used to use a cold cream cleanser for like once a week, just as like to massage it in. It was like actually like a cold cream, but it's also a cleanser, so it has a good emulsification. That I wish was here in India. I feel like it's great for all skin types. You can use it like once a week and just massage it into your skin, and then you can feel like the little whiteheads come out. I love that. And then wash it off. I feel like that's one of the best things. I wish we had that here. Can you use niacinamide? I am 17 years old. Yes, you can use niacinamide. There's no harm. It helps with hydration, helps with pigmentation, helps with reducing oil secretion. No issues, 17-year-old young lady. By all means, use some niacinamide. Make sure the formula suits you, though. And any suggestions for hyperpigmentation? The biggest suggestion I have is wear sunblock, okay? Hyperpigmentation is usually caused by the sun. And if it's caused by the sun, then we want to prevent as much sun exposure as we can. So avoid the sun from that 10 a.m. to 4 p.m. time. Use 2 to 3 fingerlets of sunblock, whether you're indoors or outdoors. Remember, visible light screens and the sunlight comes through windows, so we always have to make sure we wear enough sunblock. That's the biggest thing. Prevention is better than curing and easier than curing. Next thing is use preventative antioxidant creams, resveratrol, vitamin C. All of those are great agents to use in the mornings or at night if you like. And the third thing is good anti-pigmentation creams, as we've discussed. And finally, peels, microdermabrasion, micro-infusion facials or microneedling facials, lasers. These are all great ways to get rid of pigmentation and are very effective. I think so. I think I've answered each and every one of your questions. I'm so happy that I could do that. And thank you so much for having me. I'm Dr. Karen Sethi. I'm an integrative skin and wellness specialist. I'm here at ELLE Aesthetics in New Delhi, and I'm here with ELLE Weekender, a fabulous platform, a fabulous event to help all of us feel beautiful from the inside out. Thank you so much for having me.